one and all. Dr. Jyoti Inampuri, she is from an eminent research scholar under the field of clinical research. She is presently at Solar College, New Jersey, USA. Madam, a hearty welcome to you, first of all, and on behalf of PU and the Department of Applied Science, I am able to wishes you. Madam, I wanted to tell you few details regarding your details so that our students and faculty become to know about your work on that. Formerly, actually, Madam is an eminent research scientist in SRM University under the Institute of Science and Technology. And after that, she did her B.Pharm from Chalapati Institute of Pharmacy College from Guntur. And after that, she pursued her M.Pharm from SRM and completed her PhD also from SRM. And after that, Madam is well trained in regarding her PhD work related to sleep disorder, regarding to it, apnea. And she published overall 10 to 12 papers, national and international papers are there. And one more thing, she is one book author also, one of the chapter in this. Now, I think we have such an eminent person now with us. We will continue with Madam. I think she will give some related information which will be useful for our future research. Please, Jyoti ma'am, a grand hearty welcome again. Please, you can start your session, ma'am.
Yeah. Thank you so much, Dr. Inampudi Sailaja, for giving a brief note about me. And I thank Dr. Sailaja for giving me a nice opportunity to present the topic presently going on. So, Madam, I'm having little doubt like whether the guest, what is the link for the guest joining to the webinar? What I continue? There is no one is there.
That's right. You can start, ma'am. You can share your screen and you can start.
Yeah, actually, for the guest, what is the link to join?
Ma'am, I will share the WhatsApp one link if you try to join.
Yes. So,
you can start, ma'am. You can start in the meantime. They will
can
join.
you please share my presentation?
Yes, I will share. Jatin sir? Hello? Jatin sir? I think, madam, you can share your screen, present, and you can start.
Actually, here when I'm sharing, like present now, a window is there. So when I'm clicking on that share, but can you see anything
Yes. Now it is. You are presenting to everyone. It is coming, but there is no PPTs now. I think
So,
you shared window through you tried, not entire screen. Both the things you tried. Sometimes entire window will work, sometimes window.
okay, all right. So I will just go with stop sharing. So a window,
And
right? A window.
right, present window, yes, present now. In that window and
A
entire
window.
screen. Yes, yes. A window you try and open from
So,
your
so
click on share.
yeah, I clicked
Otherwise,
on
the
share.
entire
Me too. Sharing a window, but I couldn't
still
see anything, right?
but still we couldn't able to see ma'am
Yeah, of course, even
the
me too.
share.
I can't also see
Entire
any.
screen, you do it entire screen again.
Where is
Just
the
present.
entire screen? I couldn't see that entire screen option over here. That's the problem.
Present now, there are three options, ma'am. Present
Your
now,
present,
your
1 minute.
yes, present,
Present now here,
and
your entire screen, right?
yes, first. You click on and your repeat is open
You
and
are
click like
presenting
this,
your
and then
screen,
there is a window will open. Then click and share. Say share. Then only it will share to us.
but here I can't. It is not opening anything actually.
Actually, on your screen, while you are entire screen, if you said no, there is a small window will open in that share or cancel. Both the options will be there.
1 minute,
Click
madam.
on share. Yes,
Your entire screen.
yes. There
So
is window
choose
will
what.
open. Right. Choose one down, cancel or share. Two buttons will be there. You just click on share. Click it on window that the same screen and share like this. It will be shared.
Okay, but madam, share your entire screen. Chrome wants to share the contents of your screen with meet.do. Choose what you did like. I clicked on share, but you are presenting to everyone. But in this, nothing is coming actually. The up arrow is not working. I
Jitin
had
sir?
sent a
Jitin sir?
presentation to someone
Okay, one ma'am. I
to
will talk to
PU
them.
webinar.
Yes, ma'am. Jitin sir? Am I audible, Jitin sir? Hello? Hello? Jitin sir? आपके पास स्क्रीन है आपके पास है नहीं है मैम Hello?
Your entire screen. Oh no.
ये तो प्रॉब्लम हो जाएगा ये भी नंबर से कॉल उसको ये दोनों की उसके से पूछा
Madam, can you see anything?
No, ma'am, still no presentation.
Yeah, but here you're presenting to everyone. Stop presenting. It is coming like
That
that
is
for me.
already, that is from starting onwards it is appearing, ma'am, but we couldn't able
Yeah,
to see
same.
in practice. Yes, yes. Now it is
Madam,
okay, ma'am. Yes, yes, it's open.
great.
And you
Thank you.
can full.
Can you please share me the link for the guest actually?
Yes, ma'am. Just I'm doing it. Shaking. Ma'am, you can start in the meantime. No need to wait. Sir will join immediately.
Yeah, right.
Samskriti send it. Yes.
Yeah. So, good morning, good evening, everyone. So here today I would like to discuss on the topic artificial intelligence in early detection of neurodegenerative disorders. In another 1 hour, we are going to discuss about neurodegenerative disorders overview and the oral cell death mechanism and Alzheimer's disease and its symptoms and diagnosis and Parkinson's disease symptoms, diagnosis and etiology. Then artificial regarding the what is artificial intelligence, the history of the artificial intelligence, how this artificial intelligence is playing role in healthcare, and there are few terminologies that can be used when we are using the artificial intelligence, that is machine learning, deep learning. So we are going to look for what are these terminologies and a simple step to understand the machine learning, how it can carry out, and coming to applications of artificial intelligence and the conventional diagnosis process which are used to diagnose these neurological disorders and how the artificial intelligence is used in early detection of these neurodegenerative disorders. So coming to first objective of the presentation is neurodegenerative. Ma'am, am I audible? Ma'am,
Ma'am, your
am
presentation
I
is okay.
audible?
You are audible. No problem, ma'am. You can continue.
Yeah, thank you, thank
It's
you.
audible.
So, coming to the definition of neurodegenerative disorders. So, these neurodegenerative disorders are the most significant issues to deal with many countries with rapidly aging population. And these are characterized by progressive and irreversible loss of neurons from specific regions of the brain. And some types of neurodegenerative disorders are Parkinson's disease, Alzheimer's disease, Huntington's disease, and amyotrophic lateral sclerosis. Mostly, the Parkinson's and Alzheimer's disease plays the main role in. These are the main disorders where the most population are getting affected. So, coming to normal cell death. So this normal cell death happens due to the free radical formation, oxidative stress, and excitotoxicity, which leads to the attack of neurons in the brain. That leads to the damage to DNA and protein, and through lipid peroxidation, thus lead to the cell death. The neuronal death happens in the brain. This free radical process and oxidative stress occur due to the factors like environmental toxins, like the food and the lifestyle what we are following, and the neuronal metabolisms. So generally during this metabolism process, the free radical production will be there. The free radical production and this free radical protection are controlled by the antioxidant present in the body. So due to aging progresses or some other factors that affects our human brain, so there will be less production of this antioxidant, then the free radical formation will get increases, and thus it affects the cell death. And another main factor is aging. As the aging progresses, so there will be a decrease in neuronal new cells formation, and the neurotransmitters will produce less in the brain. Then coming to Alzheimer's disease, it is the main cause of dementia cases. Essentially, Alzheimer's is irreversible, progressive brain disorder that affects the elderly population and primarily targets memory and thinking skills. Eventually, leads individual unable to carry out the simple tasks. While there is no cure for the disease has been found, early detection has been proven to be the important for improving the quality of life of the patient. So when we see the diagram, this is the progression of the Alzheimer's disease. Is a healthy brain, and if you there will be a changes in the brain structure when the disease progresses, and this the structure is a mild Alzheimer's disease. Then in severe Alzheimer's disease, there will be even still the more changes can be observed in all parts of the brain. So then coming to the symptoms, the symptoms actually starts slow and it is gradual, and mostly the old age, the aged people above 60 of age affects with this Alzheimer's disease. So this starts with mild cognitive impairment, and the symptoms can be short-term memory. We can observe short-term memory loss. Then it progresses to mild Alzheimer's. The symptoms can be the reading, thinking, and reasoning problems will be there, and even sometimes the object recognition also will be lost. And when this progresses to moderate Alzheimer's, the symptoms are like they can't judge, and even the attention also will get decreased automatically. Then coming to severe Alzheimer's, during this process, the patient might be the bedridden with long-term memory loss, and even the visual problems also can be seen in such patients. So coming to diagnosis, there is no single test for diagnosing this particular Alzheimer's disease, where the imaging techniques can be used to detect the plaques and tangles, because the amyloid plaque and amyloid tangles are more important in this Alzheimer's disease, because as I'm not going much into the mechanism of this plaques and tangles. So these play the main role. These plaques and tangles plays the main role in this Alzheimer's disease. And complete physical examination, as I said, as the disease progresses, even the patient can't do the simplest tasks. So and the vision, the hearing, and attention also will be affected. So for basic physical examination, we are available. So to test whether it is Alzheimer's-like symptoms or another type of symptoms, and the medical history, because the past medical illness and the whatever the medicines, because sometimes the drug-induced may also affect the patient attention or memory, because due to the side effects of the drugs what he is using for the other ailments. So this past illness and any prior injuries to the brain or any surgeries to the brain. So and chronic conditions. These are the possible causes for Alzheimer's symptoms. And imaging process, because this plays a main role during the diagnosis, or we can see the brain structure, changes in the brain structure. So this imaging process will help in further diagnosis or any other particular other diseases are there. So that is pertaining to this Alzheimer's. So using this type of imaging process like CT scan, MRI, and PET and SPECT. So we'll to find and just come to the conclusion of this any sort of other disorder, any sort of other abnormalities are there that may contribute to this Alzheimer's like symptoms. So overall, this clinical data and the imaging and biomarkers, this play the important role in Alzheimer's disease diagnosis. So now coming to Parkinson's disease, this is another neurodegenerative disorder that progressively deteriorates the patient's motor system, causing tremors, bradykinesia, muscle stiffness, and postural instability. And this similar to Alzheimer's disease, there is no cure for Parkinson's disease. Early detection can help in beneficial of the patients, while it reduces the long-term treatment costs. And detection can be achieved through sophisticated new imaging techniques. So here in Parkinson's disease, there will be imbalance. There is a less production of the dopamine. And there we can say the imbalance between the dopamine and acetylcholine neurotransmitters. They're the chemical messengers. So which will pass. In a whole complete brain. So when we see the picture here, there is a normal neuron that is transmitting the neurotransmitter, that is dopamine. So where it helps, as we said, this neurotransmitter is responsible mostly for this body movements and all. So when there is an imbalance in this chemical, in particular specific region that is called substantia nigra, so there will be a movement disorders like tremor, slow movement, and rigidity. Rigidity means there is a stiffness in body muscles, and the particular person can't move the body. So now coming to the etiology. So these are the factors that contribute the Parkinson's disease, like genetic susceptibility, because sometimes the genetic also the genes also play the role in this type of neurological disorder. So these are the following genes. We will test or responsible for this Parkinson's disease. And oxidative stress. As we said, that the oxidative stress plays the major role in neuronal cell death, that is mitochondrial dysfunction, oxidation of dopamine, and react to free radical production and all. Then coming to neurotoxins, and the neurotoxins like some sort of pesticides and some sort of viral agents that also, and some sort of powerful solvents that also contribute to the cause, one of the factor for causing the Parkinson's disease. And as other causative genes like alpha synuclein, PINK1, these are the causative genes that are responsible for Parkinson's disease. As the genetic factors and the environment factors, this will always contribute to the cell death in the neurological disorders. So these are the symptoms of Parkinson's disease. So there will be a visual problem, and sometimes olfactory impairment also happens, and the speech of the patient, particular Parkinson's patient, it will be like they will have a difficulty in speaking, and a sluggishness where they will have stiffness in the muscles, so couldn't speak even loud also, and there will be excessive production of the saliva in such patients. And coming to the central, like in when other psychiatric disorders like depression, anxiety, and declining intellectual functioning, like attention functioning, also get slowly decline in some such patients. And in this patient, we can observe the dizziness or fainting and some kind of symptoms also. And they have the breathing issues in such type of the patients, and there will be a muscle weakness and aches, because due to the rigidity, the patient will have the rigid body muscles, and they can't even move the muscles. So sometimes it will lead to the aches. And such patients in gastric wise, they'll have a constipation problem. And this the second picture is like typical appearance of the Parkinson's disease, where we can easily observe the Parkinson patient, because the eye movement, because they will actually every second we will blink the eyes, the normal individual, but the Parkinson patients won't blink the eyes. There will be we have to forced closure of eyelids. So we can see in the eyelids, and there will be a loss of olfactory impairment, and even they will tilt forward. and they will have the slightly flexed hips and knees also, and in the footsteps, so they will have a giant shuffling or short stepped giant so footsteps, where in Parkinson's examination, even the clinicians will measure this footstep, means how much in how much time he is putting, and how much length he is taking the individual steps. And there will be, mostly we can observe, tremors will be there, and the elbows and wrists will be, the stiffness can be observed, and the overall posture of the patient will be like, it's kind of a bending will be there. So complete posture will be changed in such patients. So coming to diagnosis, as I said, the patient can affect with olfactory impairment, and the patient, so when we discussed about other psychiatric problems, so when the patient is having the psychiatric problems, he will have the sleep disturbances too. So in such patients, in Parkinson's kind of patients, they will observe REM behavior sleep disorder. So this can be tested using polysomnography. It is a tool to study the sleep pattern using different factors. And as we said, the imaging, the brain imaging technique plays a major role, like PET, SPECT, and specialized MRI. And coming to pathological, colonic biopsy can be seen, because to see the genetic factors like alpha synuclein, and skin biopsy is also tested. Other biochemical parameters used can be measured are cerebrospinal fluid for alpha synuclein, tau protein, and beta amyloid. Then coming to serum and plasma also collected for other further testing of the factors. And the specific genes test can be done by using the gene sequencing methods. And and as these imaging procedures, like as we just discussed about this CT scan, magnetic, CT scan is the primary thing which we can do, and computed tomography, magnetic resonance, and other EEG factors. This will give you the small, means a little diagnostic idea of the particular disease, means with the symptoms and all. And the PET scan, this positron emission tomography, can be used as a confirming diagnosis of the particular person. And this computed tomography and the CT and MRI can be used, as I said, for diagnosing any other particular diseases, like any tumors are there, any stroke. So this can be tested using this CT and MRI. Then coming to the artificial intelligence. Artificial intelligence is the simulation of human intelligence by machines, and its ability to solve problems, and it acts as the ability to act rationally, and ability to act like humans. So this artificial intelligence is used to mimic the action, mimic the cognitive functions, so that can be functions that human associate with other human minds, such as learning and problem solving. This artificial intelligence principles involve the reasoning, knowledge, planning, learning, communication, perception, ability to move and manipulate objects. So when coming to the history of this artificial intelligence, where this interestingly, this overall process started in 1950, where the idea of preparing this artificial in computer science, preparing the artificial neural networks, and further studying these things. So in that process, in 1955, John McCarthy, who coined this term artificial intelligence, and from there everything became like at that time where because in 1940s the computer has came, but it was a basic computer which can only solve very basic problems. So when the time when there is an increase in knowledge in 1974, where the computers become more faster and everyone can afford that. So at that time, this even the more research in this artificial intelligence has improved, and in 1980s is the year of the artificial intelligence, because so many researchers have joined and worked in this artificial intelligence of creating a artificial networks and artificial mimicking steps and all. Where in 2000s there is a strong foundation for this artificial intelligence have been done, and this artificial intelligence didn't limit it for its computer science or some other applications. It also extended to daily life activities, as we are going to see in rest of the slides. So one of the application of this artificial intelligence is in healthcare, where after the McCarthy has termed this artificial intelligence, it keep on this artificial intelligence keep on growing in multiple areas, where we can call it as interdisciplinary areas, because many areas are involved. So in 1960s and all, the first they had got the first problem solving program by identifying bacteria and recommending antibiotics. And in 80s to 90s, there are a growth of microcomputer, and the new level of network connectivity is seen. And the clinicians started using this artificial intelligence to get the perfect data. Means previously we used to have the records of the patients in bulk files, and also whenever the patient comes for the visit, we have to take that file and we have to see the patient history and past illness, and when the patient has visited the clinic, and what are the drugs he's taking, and what are the other symptoms and all. But once this artificial intelligence came into the existence, so the clinicians, what they're doing, they are just feeding all the details. But they're maintaining electronic records. So as these electronic records keep on updating again, so at that time they had they used to feed the basic like demographic features of the day, patient, and all, which make the clinician work very easy. And in 2010, from 2010 and onwards, this artificial intelligence is showing its importance in gene sequencing also. And robot-assisted surgeries we are hearing here and there. So still the work has to be done for other simplifying techniques. And from 2019 onwards, this artificial intelligence is used in drug discovery and drug development process, because the drug discovery development will start from the lead identification, lead development, and it goes into the preclinical, then goes into the clinical trial. This is the process of 10 to 15 years, and which costs more. So in this steps now artificial intelligence is placing, because the lead identification, the optimization, and the lead discovery will take it's a time consuming process. So by using this artificial intelligence technique, it will simplify the problem, and it can easily identify the lead, and it can optimize that, and it can give that lead, and we can further take into clinical, preclinical, and then clinical. So this is the application in health. So, as I said, a few terminologies are used in this artificial intelligence. These are the subsets in artificial intelligence, actually. As we said, this artificial intelligence is like mimicking the human intelligence. So there is the subset of artificial intelligence are machine learning and deep learning. This machine learning is like structured data. It uses the structured data to solve the tasks actually. And the deep learning is nothing but it uses the algorithms. So a particular algorithms are framed to the particular data, and it works with the neuronal networks. So there will be a vast amounts of data, because for similar for specific disease there will be a vast amount of symptoms and all. So by this deep learning we can it frames the algorithm, and then there will be a new multi vast amount of data will be there. So, and this deep learning can also used like in speech and image recognition also. The one simple example with artificial intelligence is our day-to-day life, and the most entertaining app, that is Amazon Prime, where the new movies are nowadays getting released on this platform. So where if you search one movie, one new movies so it, according to that idea, according to that search pattern, it will even suggest you may like this videos. So when we observe this Amazon platform, when we see that one, so it will suggest the movies you like, because you had typed one movie. So in that genre, in that same ideology, some other movies are also there. So it is coming like that. So this is a simple example. So now this is the simple task on machine learning. Actually, these are the steps that can be used to give the data outside. So first, what we have to do is we have to identify the problem. Means we have to in healthcare, what we can tell is we have to feed the data first, and we have to identify the problem. We have to get the data regarding that problem, and we have to prepare the data according to that. The machine will understand actually the easily understandable language. We have to prepare the data, then we have to train that model. um, because it needs the training before it is evaluating anything, or it is giving when we are bringing the data into real time scenario. So we need to train the model, then we have to evaluate whether this particular model is giving the appropriate or accurate result outside. So we have to evaluate once again, then we have to deploy, means we have to bring into real time scenario. Then once it comes into real time scenario, again we have to keep on updating the data, because once, as the same as we said, it is working like a human. Because the humans always you have to update ourselves in knowledge wise. The same will happens with this type of model. It has to update all the time, it has to update every time. The new techniques, whatever, we have to again feed into, and we have to clean the data, because of to avoid further sort of confusions. We have to clean the data, then we have to prepare the data, we have to train the model. Then this is a cyclic process. This is a cyclic process where this technique will work actually. And when we keep on updating, it will give even more accurate results when we deployed the data into outside world, the real world. So as I said, the artificial intelligence is not limited to particular area. It is developing in various areas, where we can tell it as interdisciplinary areas. So it is showing its in importance in computer science, math. These are the few applications where this artificial intelligence can be used. This computer science, mathematics, psychology, linguistics, different languages, and philosophy, neuroscience, as we are talking right now with the presenter thing, and artificial psychology also. And even in psychiatric disorders, other psychiatric disorders like anxiety, depression, and other disorders also, this artificial intelligence applications are now playing the role. And conventional diagnosis, as these are the methods we are using, because when the patient is diagnosed with any kind of neurological disorders like Alzheimer's disease or Parkinson's disease, first the clinician will take the symptoms and the patient history and the symptoms, and then he further goes into the slowly he takes into the other tests like MRI, CT, SPECT, and PET, and he will use some clinical tests because how the symptoms are, whether it is mild, moderate, severe, because Parkinson's and Alzheimer's are like mild, moderate, and severe. So to classify this particular stage of the patient, in which stage, so there are few scales are available with some scales of like they will have some score in that one. So for 10, and there will be multiple choice questions where the clinician will perform on the patients, like mini mental scale examination. It's like mini mental scale examination is like where the patient mental health scoring. How often he will forget the things, how often he's performing the day-to-day tasks and all. So based on the score, they will categorize the patient into mild, moderate, severe, and based on that, they will go into further clarifications of this studies. And then other biomarkers. Studying the biomarkers, we can come to the conclusion of the study. As so many tests are present, and so many diagnostic tests are present, but there is no particular effective therapy that can cure, because already we had discussed in the definition, this is an irreversible process, but there is no therapy to manage the symptoms so far. But and at the same time, in the early stage, there is no test available in the early stage, because sometimes if we perform mini mental scale examinations, so there will be a normal how often the patient will perform his own tasks, or how often he may forget the things to do in the workspace or at home also. So when sometimes we may also give some average answers. So what the clinicians will come to the conclusion, like maybe due to the age or some sort of stress, this may happen. So they will rule out the things. So there should be some early diagnosis techniques. To prevent the confusion, for the clinicians to come to one conclusion. So then here where now then here the artificial intelligence is playing the role. So here the machine learning. This as we spoke, this is a subset of the artificial intelligence. To help the clinicians with computer-aided diagnosis. So here the clinicians will get the data, and they will feed the data into the machine, and then it will evaluate the possibilities of all the symptoms and everything, and it will come to one conclusion. And this machine learning techniques analyze the structured data, such as imaging, genetic, and electrophysiological data. And although sorry, the machine learning is based on mainly, as I said, so it will analyze the structured data, means the imaging data. So in Alzheimer's, mainly the brain structures, where we had seen in the first picture, the progression of the disease, there will be changes in the structure of the brain and in specific regions. And using this machine learning technique, this imaging data can be studied. And in Parkinson's, as we said, the speech will become sluggish and slow. So the voice detection technique is designed in this particular machine learning way. And coming to the deep learning, because both this machine learning and deep learning will play a role in different ways of diagnosis of the disease actually. So in deep learning, so although many artificial intelligence related applications have been developed to assist this deep learning, in this two process, mainly like convolutional neural networks and recurrent neural networks. Regarding this, we will study in the next slide. So with the help of this machine learning techniques and deep learning techniques, the patient the early diagnosis can be done in the patient to improve the quality of their life actually. So um, this is the exact procedure what it will be followed. So in the early diagnosis, so this MRI, EEG, and kinesics. These are the process. These are the three major techniques for brain observation in the clinicians mainly use. So this MRI, this is the predominant technique for behavioral and cognitive neuro. This is the in cognitive neuroscience. Mostly, as we already spoke, this MRI will see the structures of the brain. And EEG is like this is the easy technique, and we can tell readily, easily available technique. So first, the clinicians will ask the patient to take the EEG because this diagnosis and treatment. This helps in diagnosis and treatment of human brain and other nerve symptom diseases performed by detecting and recording the human signals. So when compared to this CT, MRI, EEG have a higher temporal resolution. Despite the limited spatial resolution of EEG, this is still a valuable tool for research and diagnostics, especially as I said in other psychiatric disorders like anxiety, psychosis, and depression. This EEG reading is done in the graph actually. So to analyze this machine learning techniques are available because the EEG signals are like from all over the brain. The EEG signals are generated in the wave form actually. So few waves like alpha, beta, delta, and the gamma waves are mainly present in this in our human brain. So by studying this, the clinicians will come to one particular diagnostic idea. So kinesics data is like including behavioral, facial, and other data. Very important in study of pathogenesis, development, and diagnosis. It helps in diagnosis of some particular disorder because the facial emotional facial expressions in some disorders like depression and in some sort of schizophrenic patients, there will be a facial expressions, and as I said in Parkinson's, the facial expressions. So this can be studied by using this kinesics thing. So when compared to so when coming to this particular method, so how we are using is before the artificial intelligence can, as I said, before the data is deployed, coming into real time scenario, the healthcare application they need a trained through data so that are generated from clinical activities like as I said, the screening, diagnosis, treatment, assignment, so that they can learn similar group of subjects as the machine can learn similar group of subjects, associations between the subject features and the outcome of the interest. Specifically in diagnosis stage, this artificial intelligence analyze the data from diagnostic imaging and genetic testing and other electro diagnosis. So the as I said, in health, in the patient demographic features and other diagnosis can be fed, and laboratory examinations, the physical examination and other biomarker examination or genetic examination. And where so this laboratory comprise of MRI, EEG, and kinesics, everything, and then we will feed everything into this artificial intelligence model, into this algorithm, and which it will study and give the possible diagnosis of the disease. So this is the brief procedure what the clinicians mostly follow with this type of artificial intelligence techniques using the algorithms in this. Deep learning and machine learning. So where I said regarding the conventional study and deep neural networks will place the role here. So then coming to the artificial intelligence in healthcare. So as I said, now the artificial intelligence is playing role in drug development and discovery and in other applications too. So these are the few companies they adopted. They are using this artificial intelligence in different stages of the drug discovery and drug process. As we can see. In oncology they are using, and in neurodegenerative disorders and immuno-oncology they are using even the breast cancer techniques, even in cardiovascular diseases also there. These are the companies that are right now using this artificial intelligence to bring out the specific any drug for the specific disease, because as we know the drug discovery process will takes place years and with high cost. So these are the companies that are using. And finally, thank you. Madam?
Okay. Yes, Jyoti ma'am, it's a nice and really an informative talk actually. Actually, I have few queries. You can, I think you may can clarify it so that I can further work on this also. We are also interested. So that,
Yeah.
sir, madam, actually, what may be the timeline that disease might to moderate and severe condition changes we can observe? Alzheimer's disease, the timeline for each and every stage.
Yeah, mostly it will first start, this Alzheimer's first start with the cognitive impairment. As I can said in a normal language, it is a memory loss. There will be a short-term memory loss will be there. And we can easily observe from the patient, like they will forget the things, and they will have even attention problem, because as they can't do the simple tasks at home. So these are some of the myths.
Yes,
The person itself,
yes.
the person will himself will complain like, I am facing nowadays this sort of problem. I'm forgetting some things and I'm unable to do the things like that. The patient himself will complain at home actually. Yeah.
And maybe this one more question, ma'am. Maybe this
Yeah.
in the early detection through, is it possible through molecular techniques?
Of course, molecular techniques, yes, molecular techniques also, but it is a time-taking process, because once you have to diagnose with the disease, because when if we go to right, if for example, if I go to a clinician, because otherwise I can tell you like this: if the patient comes to me, because as we used to do the clinical trials in neurodegenerative disorders, the patient comes to me. First of all, what we will do is we will take the demographic pictures, the past history, and the family history, and the drugs what he is using. Then we will go into the further assessment. As I said, the scales are available, right? Scales are available, clinical
Yes.
examination. So we will fill that one, and then we will come to one primary conclusion, like he is showing this type of symptoms. So then we will ask him to take this EEG. So once the EEG is also confirming there is some abnormality we can see. So further we will ask him to go for MRI or a CT to further diagnosis. So once the patient is showing in MRI and in CT, there is some changes in the brain, because changes can be due to aging process, because this is the confusion. Sometimes the brain changes due to aging to this disorder. So we have to rule out this one. So then we will ask the patient to take the final test like PET, positive on emission. So where we can clearly see the patient, and here we have to think about the cost of the patient, how much affordable the patient is to go for all these tests.
Okay, ma'am. And one
So
more. Yes, ma'am. Please.
So once the patient is confirmed with all these things, the patient is having particular disorder, then we can go for the lab examination, gene and molecular level also, to study the gene pattern.
Okay.
Yeah,
And
this is the thing
with that we
actually.
can, yes, actually, we can get, I think, something more informative from your side, ma'am. And
Yeah.
I wanted to know one more thing. Either you are saying using the technology of the artificial intelligence, so we can
Yes.
detect it early detection is possible.
Yes.
And even also AI also we should collect the data and we should feed the data, and mostly what time it will take means the person whether it is having that much time. Otherwise, in the meantime, you will start the medication also simultaneously according to the
No. No,
symptoms. What?
to manage the minimum symptoms, so we will start the medication very primary. But for Alzheimer's, the whatever the medication, Alzheimer's, Parkinson's like levodopa and all, we won't give in the initial stage.
Okay. Okay.
We
Okay.
won't give in because it will produce the side effects too. So once if our diagnosis is a misdiagnosis and we
Yes.
start our medication, if it gives the other side effects, then it will be the fault that we didn't studied elaborately the patient condition and we started the medication. This will be other problem for us. So that's what the
Means
artificial intelligence, what it will do is when we get all these reports, because to get the reports of all this and studying by the clinician and come to one conclusion, it will sometimes take more time actually, because as we humans, we will think in number of ways also. But here, the what
yes.
machine will take is how we the past data what we will keep, the similar data what we will keep. It will rule out some possibilities and it give you final idea, final say diagnosis actually.
Yes, finally, yes. Which way we should proceed? Means then I want to
Right,
be clear
right,
by using this.
right.
It's
It will
very
give you the
yes,
idea.
yes,
In
clear picture
between
of the
some
patient. Right.
yes, in between
Got it.
some tests we can rule out and then we can go to final test and we can start the medication. This is the early detection.
Oh, one more last question, man. What is the
Yeah, please
role
go
of
on.
depression in this, what we can call this type of diseases, Alzheimer's or maybe
Right.
Parkinson's? But depression,
So
because nowadays I mean, a hot topic in Bollywood actors, also we had seen recently. Okay, and drug cases, we are observing it, how the people are
right.
going to be, because education is nowadays it becomes to like this. It leads to in another way, not in a
Yes.
proper direction. Actually,
Yes.
they are taking into, they are going into more and knowledge is taking them into a wrong way. So,
Right.
in such a scenario of this society, what is your opinion regarding the depression? Why they will divert into in that side? So whether maybe these depression conditions only, maybe that means the grown up culture condition, maybe factors. There are so many ways we can think it. But in that, I
Uh,
want to know it depression how it will play out.
Right.
In such
So,
cases.
in such kind of patients, how the depression plays the role is. So the way of thinking of the patient, like because he can't think, he can't perform, and the people around him who will tell like. There will be more dependency in such type of diseases actually, Alzheimer's, Parkinson, because Parkinson's the patient can't stand properly even.
Yes. Yes.
So such type of patient will have, we need the support. So when there is no proper support, or they may think, okay, something is happening to me, so which
Mm.
I couldn't explain. So there will be a deep thinking, and they will have some sort of disturbances because they won't
Yes.
sleep. They will keep thinking. The stress increases, and they will feel something is happening, and there won't be a positive approach of the people around him. So
Maybe in such
and the fear,
patients, we
fear
can
what he will
control
develop.
them. Yes. In such cases, we can control their emotions and everything through by some medication and
Of course, yes,
some
there will be
cases. I think it will
antidepressants
work better,
there.
right? That is
Some sort of
medication.
some
Yes.
sort of antidepressants will be there, and to calm the patient,
Yes.
mostly they will use this antipsychotic drugs actually to calm the patient,
Right.
because when the brain is at rest, only the patient can be
Yes. Yes.
normal without any thinking. So that's what even the persons with this kind of neurological disorders, the doctors mainly, because the patient complaint will be sleeplessness, disturbed sleep.
Yes. Yes.
So,
Yes. Yes.
nocturnal awakenings, like in midnights, they will get up very easily, or number of awakenings more, it will be there. So, such type of patients, they will have these complaints, and then the clinician immediately will write some sleep-inducing medicines or some antidepressants and anti-anxiety drugs, antipsychotic, calms the brain and will the patient can sleep peacefully, and so they won't think further. Mostly, I can't tell they won't think
Yes.
further. That thinking will be there, but
their brain may can get into some state,
Right.
stable state,
Yes.
so the thinking
Yes.
quality will make
Yes.
it.
Here, drug is
Okay,
inducing
ma'am.
the sleep for them.
Yes, that's true. That's true. Okay,
That's
madam.
correct.
Actually, actually nice information we got it really today. I'm happy
Yeah.
to share my vote of thanks to, because really it's important. Maybe we can get an idea artificial intelligence and where we can apply it more in the field. I think so. Thank you so
Yes.
much again, Jyoti ma'am. Thank you for your valuable time for
A very small
given to
example
us. Yes,
artificial intelligence used is in hospital. If we go, the records they will take out within a
yes,
few
maintaining the
minutes.
records. Yes,
The electronic records, actually, EMR
yes,
records,
maintaining
electronic
electronics.
medical
Yes.
records. So there, this artificial intelligence is also playing the role because this is emerging area and very interesting
Yes.
area too.
Yes. Thank you, ma'am. Thank you so much, ma'am. Nice talking
Yeah,
to you actually, and nice sharing all the contents. I think, ma'am, you received a message from our new webinar. You should
yeah, right.
please send
Yeah,
your
of course.
PPTs. Yes, yes. Please don't forget
Yeah,
it. Please share it, ma'am. Yes, ma'am. Yes,
yeah.
ma'am. Thank you so much. Thank you
Thank
so
you.
much.
So once
Yes.
again, I would like to thank Dr. Ainampudi Sailaja and Dr. Samskriti Upasana,
Yes.
a very good friend of mine, for the opportunity you people had given to me. And I would like to thank the Parul University arranging this webinar, which even I also learned a new things in this
Yes,
preparation of
yes.
the webinar. Thanks a lot. And I am very interested in future also would like to participate in the activities.
Sure, sure. Thank you so much.
Yeah, thank you, madam. Thank you.
Yes, ma'am.
Bye, madam.